Good evening, everyone. This is Bala from Integrated Wellness Science and Practices, your host for the day. So, on behalf of our team here, I welcome all of you to the live webinar. So, we are going to talk about chronic pain management through integrated medicine today. So, we are IWSP is a platform where we integrate modern science and the time-tested traditional practices to transform lifestyle in order to prevent, manage, and reverse health disorders. So, as we know, today we are going to speak about or see how chronic pain is managed through integrated medicine. We have with us today Dr. Shruti Sridhar. Dr. Shruti is a general physician and integrated medicine practitioner, and Ms. Swati Sridhar. Ms. Swati is a yoga therapist, and she is from Swayogini Yoga. So what we will learn today, the 1 hour session, is we will learn about what is chronic pain, what causes it, and in the current scenario, what are painkillers doing in treating the chronic pain, and why do we believe integrated medicine is the best in treating chronic pain. So these are the various important elements of the today's program, and we will also be guiding you through how integrated medicine can be applied to treat your chronic pain conditions. And a couple of practical information before we start. So we request to mute your microphone throughout the presentation. As and when you get your questions, please send them in the chat box so that our backend team will keep collating it. At the end of the presentation, Dr. Shruti and Ms. Swati will take your questions. So over to Dr. Shruti.
Thank you, Bala. I'm going to just quickly share my screen. So good evening, everybody, and thank you so much for joining in. If you're following Reach, you will know I did another talk on chronic pain reversal a few weeks back. And today it is the part 2 of the same talk. Today the presentation is slightly different because I think I want you to understand why a different approach is important in chronic pain management and what is lacking in today's current scenario, like the way the doctors are treating chronic pain issues. Right. So first, let's understand what is chronic pain. This is a question that a lot of people have asked me. Oh, what constitutes as chronic pain? Am I eligible for treatment? Will this work for me, etc., etc. So any pain that is lasting for more than 3 months, right? It could be anything. It could be back pain. It could be knee pain. It could be an ankle pain. It could be headaches. It could be breast pain. So any pain, period pain. So any pain which is lasting for more than 3 months, or it's cyclically coming for more than 3 months. Any pain that continues after the tissue healing has happened. All right, let's say you had an injury. The injury has healed. There was a fracture or a ligament tear. It has healed completely, yet you continue to suffer from pain. It interferes with your daily living or your daily activities. It can cause mood changes. So somebody who is suffering from pain throughout the time, it's very difficult to maintain a good mood along with that pain. So mood changes and chronic pain can go hand in hand. And it also indicates that there is some form of inflammation which is going on in the body, which is unaddressed. Now here you have to understand that pain is just a symptom. It can indicate more than 50 diagnoses underneath it. All right. So it can be, for example, as I said, it can be migraines causing chronic pain. It can be arthritis causing chronic pain. It can be fibromyalgia, irritable bowel syndrome, lumbago or back pain, sciatica causing chronic pain. So chronic pain is just a symptom, which is trying to indicate that there is a deeper problem, a deeper inflammation, which needs to be corrected. All right. So now I'm going to take you through 3 case scenarios, and these are people that have got in touch with me over the last 5 to 6 years. I just found their cases interesting. So without divulging any personal details, I just want to share this with you to understand how this conventional approach is lacking when you are trying to reverse chronic pain. All right. Now, the first case is of Mr. A, who is a 39-year-old male with irritable bowel syndrome, also known as IBS, with generalized body pain. All right. He has been taking painkillers and IBS medications for the last 20 years. Now, this is actually a very common scenario that I see. All right. Because of the irritable bowel syndrome, he's been taking medications to improve the functioning of his gut. And because he's been suffering from generalized body pain, even though he had been an athlete 20 years ago, he is no longer able to practice any proper kind of sports. So you can understand how much of a lifestyle change has happened because of his condition, right? So when he came to me, he was just on these medications on and off, and that's how his life was. So what lacked in the approach, in the treatment approach that doctors took for him? First thing was the cause wasn't identified or corrected. All right. So saying that your pain is because of IBS is not helping anybody. So, okay, you understand you have IBS and it is causing the pain. So what? You have to understand what is the cause of the IBS. Is it depression? Is it some wrong food habit that you have? Is it your lifestyle which is a problem? Is it that you are having late nights? Is it that you are having a night shift job, etc., etc.? So understanding what is the cause of your condition. And in this case, the cause was not identified. The focus was on pain management. So whatever symptoms he had, that was being managed. But the cure was not being given. And no advice was given to him regarding exercise, yoga, lifestyle changes, diet, nothing when he came to me. So you can understand how so many lacunae or limitations are there in the conventional approach to chronic pain. Now let's take a second case. This case is of Miss B, who is diagnosed with fibroadenoma of the breast with delayed periods. So she is 34 years old, and she has come with fibroadenoma of the breast, which means that there is a lump in her breast, which is painful. And she also has delayed periods. They never come on time. And in her history, she told me that the fibroadenoma was operated on one side. Now she has developed a fibroadenoma on the other side, and she still suffers from breast pain during periods. So clearly her problem was not resolved. So what lacked in the approach that was done? In her case, fibroadenoma was operated. That was the first mistake, because we all know that fibroadenoma is because of hormonal imbalance, and that hormonal imbalance was not addressed, was not corrected, and so the fibroadenoma kept growing, kept continuing, and no advice was given again on diet changes, lifestyle changes, and the cause of the fibroadenoma. These things were not addressed in the case. Now let's take another case. Now this is a case of Miss C, who is another 34-year-old diagnosed with adenomyosis, which is quite severe. Now in adenomyosis, what happens is basically the uterine tissue increases in size, all right, and causes a lot of pain during the periods. And she has been on hormonal pills for the last 4 years to control this pain. And she's still complaining of pain during her periods. And now when she came to me, she had also developed fibroids along with the adenomyosis that she was having before. So clearly her issues were not resolved. In fact, they were progressing. So what lacked in the approach in this case? Again, hormones were given. The hormonal contraceptive pills were given for this patient, and hormones, they worsen hormonal imbalance. Okay, you have to understand that, because we are giving hormones externally and we are interfering with the body's own hormonal rhythm. So it causes worsening over time. Maybe for 3 to 6 months, it can be helpful, but taken for longer duration, it can cause worsening of the hormonal imbalance. Again, no advice was given on diet and lifestyle changes. And this thing in her past was not asked about. She suffered from depression preceding her diagnosis of adenomyosis. So this part was never addressed in her case. And this is, this is one of the major reasons why she got adenomyosis in the first place. So you can see in all these three cases, clearly major, details were missed. And there were so many chances the doctors could have gotten to reverse the condition, but it was not taken because a lot of the doctors are not aware of this thing. And this is a very, very unfortunate part. All right. So now that we have discussed these three cases and what lacked in their approaches, I want to explain how a different approach can be taken. So how can we take a different approach? Right. So let's first understand what makes a pain chronic in any condition. All right, in any condition, what is it that makes the pain last for more than 3 to 6 months or even more than a few years? Okay, for the pain to consistently come. The first reason is intrinsic organ inflammation. So basically, let's say you are having arthritis, there is inflammation of your joint. So if you don't address that inflammation, the pain is going to persist. All right. Similarly, if you have a lot of period pain, there is inflammation in your uterus or ovaries. And if that inflammation is not addressed, you are going to have chronic pain. Now, the second thing which happens is muscle tightening. All right. Let's say, for example, you have arthritis in your knee joint is painful. So you experience discomfort when you're walking, going up the stairs, sitting down. So what your body starts doing is it tries to tighten the muscles around the knee joint so that to provide protection to that knee joint. This is a very subconscious process. A lot of people are not even aware that their body is doing it, which is why somebody who is suffering from polyarthritis, that is arthritis of multiple joints in the body, they always come to me with body stiffness. And the reason their body is stiff is because all these side muscles have tightened themselves to make sure they are supporting the joint that is inflamed. So muscle tightening is the second reason why the pain starts becoming chronic. So let's say your muscles have tightened, but you have addressed your joint inflammation. Your joints are fine, they are no longer inflamed, but these muscles around the joints have forgotten how to relax themselves. So relaxing the muscles, knowing how to relax the muscles is the second step to reversing this chronic pain condition. Now, the third reason why the pain becomes chronic is a process called as central sensitization. Don't worry about the name, it's very scientific, but I can explain you. So when somebody suffers from pain and inflammation for a really, really long time, there are certain physiological and anatomical changes which happen in the brain and in the spinal cord and in the nerve pathways. So these changes over time become persistent. And because of these changes, there can be increased sensitivity to pain and also decreased in the signals which actually cause the pain to stop. They are called as inhibitory signals. So these signals start reducing, and the signals which cause pain, they start increasing. All right, and we have seen that, like studies have shown that the amount of the connections that the neurons are making, the type of connections the neurons are making start changing over time. So if somebody wants to address their chronic pain, this central sensitization part also has to be addressed. Otherwise, the body is not able to forget that the inflammation has gone, the disease has gone, and the pain still persists even after the part has healed. And lastly, psychosocial. Now, this is also a very big component when it comes to chronic pain. If there is anybody who is suffering, who is listening to this, would know that if they are in a good mood, like they are with family or friends having a good time, the perception of pain goes down. If they are in a bad mood, they are suffering from some other financial loss, family issues, personal relationship issues, etc., the perception of pain is heightened. So psychosocially also, the perception of the severity of pain gets impacted. So once all these four components are addressed, only then the chronic pain can be reversed completely. So what are the 4 R's that have to be done? First is to recognize the cause. As I said before, if the cause is not recognized, you will be only treating the symptom and not addressing the cause, and the problem will never go away. Second is to reduce the inflammation. Once the inflammation goes down, automatically the pain goes down because the body stops fighting. Third, as I said, because of muscle tightening, relaxing the muscles is a very, very important aspect. And lastly, to retrain your brain pathways so that the central sensitization, which I talked about, that can be addressed. So these 4 R's have to be present in anybody who is trying to reverse their chronic pain, right? So just briefly trying to understand who this program is for. I honestly feel that this program could be for anybody who is suffering from a chronic ailment, because pain is a very, very common symptom that we get of any chronic illness. Like, for example, if somebody is suffering from diabetes, they'll be having a burning sensation in their feet, pain in the feet. They might have frozen shoulders, pain in the shoulders. So these are all complications of diabetes, which eventually lead to chronic pain. Somebody who is suffering from anxiety. Anxiety can cause muscle tightening on various levels and can lead to chronic pain. Somebody who is suffering from depression, somebody who is suffering from irritable bowel syndrome, autoimmune conditions. So I have just tried to put down certain diagnoses which are very common, and in these diagnoses, pain is one of the main symptoms that affects them. So for them, the most important thing is, I want to get rid of my pain. And it is quite severe in some cases. So these are some of the conditions which I have jotted down, like chronic musculoskeletal pain, chronic pain due to sports injuries. Now, this is something I have also seen. Anybody who is very active in their teens and early 20s in sports, after 20 years, they are diagnosed with chronic musculoskeletal pain. And when I ask them, do you remember when these pains first started? They would say, I think I had an injury when I was 19 or 20, and this ankle of mine was never normal after that. This is a very, very common line that they would say. So this pain, which has the inflammation has resolved, the injury has resolved, but the pain continues in these cases. IBS, which I have discussed, post-surgery chronic pain syndrome, fibromyalgia, cluster headaches, migraines, all these come under autoimmune conditions, arthritis, complex pain syndrome, chronic pelvic pain. And in psychosomatic pain, you have depression-associated pain, anxiety-associated chronic pain. Ankylosing spondylitis and chronic fatigue also now is coming under autoimmune conditions. So these are just a general list, but if anybody is suffering from pain as a major symptom, then this program is definitely something that you can think of. Now, what are the objectives of the program? Is to understand the mechanisms of chronic pain. I have tried to make it a little concise in today's talk because there is another presentation coming up which is more important. So in the program, there'll be recorded videos which will take you through the mechanisms of chronic pain. I feel this is important because whenever I explain to my client or my patient saying that, oh, this is how your pain is working, this is the reason your pain is not going, they seem to recover better because they understand it, they can work towards it, and we see like positive changes after that. So understanding your body, understanding your pain, understanding your condition will help you in the healing process. Second is to understand the underlying cause of the pain, like why you have this pain. Integrative approach to address the root cause, as we just discussed in 2 slides back, and to reduce dependency on pain medication. So as you have seen in the cases also which I discussed, pain medications are nothing but an emergency tool to help you tide through acute pain. but they can never be a cure for chronic pain conditions. Anybody who is on pain medications will know that they have to continuously keep taking it. Sometimes they have to keep changing the medicines because the body gets tolerant towards it, and they also suffer from unpleasant side effects like nausea, vomiting, weight gain, acidity, etc., bloating. All right. So through this program, you can definitely reduce your dependency on pain medications and even stop it. And lastly, you can improve your quality of life. So these are the objectives of the program, and which is why we have made it very comprehensive, because just addressing one component will not address the whole issue. Right. So this is a nutshell of what we are doing. There are consultations, follow-ups. We have Yoga Nidra, which Swati will be talking about in the next presentation. And this is going to address the central sensitization part and the psychosomatic component of the pain. And we have found out by doing it on our clients also over the last 1 year that it is very, very effective in reducing it. Reducing anxiety, reducing the pathways in the brain. We do see an improvement in the pain, in the condition, and even reduction in the medications that they have to take once this is added on to their protocol. And there will be bi-weekly reflective sessions for group discussions, because it forms a community where you can learn from each other and understand what you have learned through your healing process, right? And there will be recorded videos available on the platform, and these videos will help you guide how you can affect these lifestyle changes, which will help you reverse the pain, right? So this is a nutshell of the program, and I